Our final plenary speaker today is Dr. Gregory Landry. Dr. Landry graduated from Indiana University School of Medicine and completed his residency in pediatrics at the University of Wisconsin-Madison. Following a fellowship in ambulatory pediatrics, Dr. Landry joined the faculty of the University of Wisconsin Medical School. Since 1984, he has served as head medical team physician for the University of Wisconsin's athletic teams and as a staff physician for the University of Wisconsin Hospital Sports Medicine and Fitness Center. In 2001, the American Academy of Pediatrics section on sports medicine awarded him the Thomas Schaefer Pediatric Sports Medicine Award for lifetime achievement in pediatric sports medicine. His topic today is tackling in youth football. Dr. Landry?
Thank you all for staying toward the end. I must say I'm humbled by the quality of the speakers who preceded me. One of the reasons I'm tackling the subject of tackling in youth football is that over a year ago, Bill Meehan and I were charged with the task of addressing this issue in a statement for the Academy of Pediatrics. And so this is a very timely talk because in fact they lifted the embargo on our statement last night at midnight. I have no financial disclosures related to this statement or this talk. I do feel obligated to tell you that I might have a little bit of bias because I'm a football guy. I grew up as a son of a high school football coach. My college tuition was paid for by playing football. I was a Butler Bulldog in Indiana. And I have served as a team physician for UW football for 25 seasons. So I've seen the good, bad, and ugly of American football. I must acknowledge Bill Meehan, who was not only the co-author, but actually the lead author of this statement. He, as many lead authors do, he did the bulk of the work. I just have the privilege of presenting it to you today. After this lecture, I'm hoping you'll be able to respond to the question, should I let my child play tackle football? Be more knowledgeable about injuries in youth football? Be more knowledgeable about the relationship between tackling and injuries? And know the potential adverse effects of learning tackling at a later age. So I should clarify some of the terminology. This talk will focus on American tackle football. Elsewhere in the world, football is known as soccer. If you PubMed football, most of the articles will be about soccer. Tackling, of course, occurs in American football and rugby, and tackling is the act of stopping the forward progress of the ball carrier by seizing or grasping the player and knocking the player to the ground. So the reason why we were asked to do this statement is there are many people, including physicians, who are calling for a ban on tackling in youth football. Bob Cantu, who is a very prominent neurosurgeon who's done a lot of research and publishing on concussions in football and head and neck injuries in football, wrote a book in 2012 talking about concussions in our kids, and in the book, Bob says we should not let kids tackle until they're 14. Some even want to get rid of high school football. Why? Well, some of this is driven by increased media attention to concussions, which of course are quite prominent in the sport of football. The reports of CTE, which is chronic traumatic encephalopathy, a debilitating brain disease seen in a small number of former football players, pro football players. But I think a lot of it is fear driven by media reports and based on emotion. So Bill and I were charged with looking for evidence related to this notion. First of all, I want to comment on injury rates. In most of the youth football studies, there are very low rates compared to older players. Not all studies, but the majority show that the little kids don't generate the injuries that the big kids do. And in fact, catastrophic injury rates are higher in gymnastics and wrestling. The most commonly injured body parts at all ages are knee, ankle, hand, and back. And I want to review one of the bigger studies that was done on youth football. This was a study done by Dampierre, 2007. They looked at 776 football players, ages 9 to 14, a little bit older than some of the youth football studies. It was a 2-year observational cohort study, and they looked at only time loss injury. which is common in sports medicine to only count an injury if it resulted in loss of time from practice or a game. They had 474 total injuries and 26,564 exposures. In the sporting world, the best way to track injuries is to count every time a player has the potential to get injured. The overall rate of injuries was 7.4 per 1,000 athletic exposures. And like many other studies, they demonstrated that the rate went up with age. So for example, if he just looked at his 4th and 5th graders, the injury rate was 4.3. In the 8th graders, it went up to 14.4. When they looked at what body parts were injured, again, most of them were extremity injuries, but there were 4.6% of injuries to the neck and spine, so it's not totally benign. Half were contusions, just bruises. Many were sprains and strains. And for the more significant injuries, 2.5% were fractures, and again, 3.4% were neurologic. So there were some more significant injuries in his cohort. Dr. Stewart, report out of Mayo, looked at football players ages 9 to 13. He had 915 in his study. He just looked at game rate, and one of the common themes is game rate is always higher than practice rate. And the game rate in his paper was 8.47 per 1,000 athletic exposures. They observed more injuries in the higher grades. This is a pretty consistent finding in all of the studies, and running backs seem to be at the highest risk for injury. And this compares to high school rates for games of like 12 and 12.6 in a couple of the high school studies. So if the concern is about concussion, then why aren't the researchers looking at concussions? And in fact, they did. Contos published in 2013 a study of concussions in a cohort of 468 kids, 8 to 12. The concussion rate in his paper was 1.8 per 1,000 athletic exposures. And sure enough, the games had a much higher concussion rate of 6.2 compared to practices of 0.24. And then when he split out the age groups, the 8 to 10-year-olds were 0.93 per 1,000 athletic exposures versus the 11 and 12-year-olds, which are 2.53 per 1,000 athletic exposures. And again, this is a common theme in most of the papers, that the injuries are more likely to occur in the bigger kids that generate more force and more power. So what about this notion of tackling? Well, it turns out tackling is the most common player activity at the time of the injury and at the time of severe injuries. This accounts for about half of the injuries at the high school and college level, and we assume that this is probably true at the youth level, although it's not been looked at nearly as much as it has at the high school and college level. And the majority of the concussions that result from tackling, either tackling or being tackled. So the actual act of tackling, in fact, is risky business. And then Contos also wrote in his article that head-to-head contact was one of the leading causes of concussions sustained by youth football players. So Bill and I acknowledge that banning tackling in youth football would undoubtedly reduce injuries. The problem with this, though, is it potentially would lead to older players learning proper techniques when they're generating more force and more power. And could this increase the injury rate in the older players who are not very knowledgeable about how to properly tackle? Nobody's looked at this, we don't really know, but I think it's a potential risk of banning tackling at a younger age when the kids don't generate nearly the force. So what is proper tackling technique? Well, there's been some debate. Those of you older gentlemen in the office can remember being taught tackle football by leading with your shoulder. And of course, as football helmets improved, players began to stop using their shoulder and using their helmet and their head. And the problem is, pictured on your left is a youngster who is improperly. He has his head down. He's first striking the other player with his helmet. This not only increases his risk of concussion, but also a C-spine injury, because now the C-spine no longer has its physiologic curve, and with axial loading, is at higher risk to sustain a significant C-spine or spinal cord injury. So a group got together with USA Football, including some physicians, and they decided the priority must be that the head be up when the player tries to tackle someone. And so pictured on the other side is the proper way that they're trying to teach youngsters how to tackle by leading with their chest, with their head up, and wrapping their arms around the other player. So after we actually wrote the statement, a very important paper was published by Kerr in the Orthopedic Journal of Sports Medicine. And they looked at they had an opportunity to look at different leagues in Indianapolis, some who implemented this new technique and some who hadn't. And so these kids were 5 to 15. They examined the number of injuries in the non-heads-up teams that had not adopted this program, with teams that had. And they also looked at Pop Warner leagues because Pop Warner also implemented a change and the Pop Warner leagues reduced the number of practices where they were allowed to do contact. And so there was a little bit of a confounder here, but they looked at all three groups. And they had 370 total injuries, 71,262 athletic exposures. And the practice injury, in fact, was lower when leagues implemented both Pop Warner and the heads-up technique. That injury rate was 0.97 per 1,000 athletic exposures. And then if they looked at just the non-heads-up group, they were 7.32 per 1,000 athletic exposures, and needless to say, that was statistically significant. And in fact, even if they just did the heads up only, they were significantly lower at 2.73 per 1,000 athletic exposures. So these findings suggest that these programs will help reduce the risk of injury and probably concussions. So let me summarize what we said in our statement. And again, the statement now is available to you since the Academy released the embargo. Officials and coaches must enforce the rules. No head-to-head hits, no leading with the head. That's the problem with American football, is the whole game has changed. And fortunately, you're seeing this at the college level and somewhat at the professional level. In our second game at Wisconsin, we had 2 individuals disqualified for what is now called targeting because they led head first to another player that was defenseless. And fortunately, our coach and our players, even though one call was a little questionable, backed up the refs and said, we got to make the game safer. Although banning tackling will likely reduce risk of injury, it totally changes the game of football. In ice hockey, if you don't check, it's still ice hockey. Ask any of the girls that play ice hockey. But if you take out tackling from tackle football, it's a fundamentally completely different sport. We encourage football leagues to offer a non-tackling alternative for families who do not want the risk of tackling, such as flag football. Although the problem is injuries in youth flag football need to be studied. There are virtually no data on youth flag football, and actually the information on adult flag football shows a pretty high injury rate. Coaches and officials should do what they can do to reduce the number of hits to the head. Further research is needed in this area. This is a photo from about 7 years ago of a Minnesota defensive back hitting Kyle Jefferson, our receiver, right after he caught the ball. And this is a high-risk tackle. Turns out he knocked Kyle out. Kyle had to be boarded. Fortunately, his head and neck ultimately were okay, but there was no penalty. Nothing was called on this play. Delaying the age at which tackling is taught could make tackling more dangerous if learned when the athlete is faster and stronger. Again, just a theoretical risk. It's not been studied. Perhaps it does need to be studied. Although scientific evidence is sparse, there is some evidence that football players who strengthen their neck muscles will likely reduce the risk of concussions with head impacts, especially if they can see the blow coming. This is just a photo of an individual doing some isometric neck strengthening exercises. And finally, we support the hiring of athletic trainers whenever this is possible. We realize that for many youth programs, they don't have the money to hire an athletic trainer, but in fact, athletic trainers have been shown to reduce injury rates when they're present and helping athletes with equipment and techniques to prevent injury. So bottom line, at this point in time, based on limited evidence, we could not make a case for banning tackling in youth football. And finally, let's not ban the game, let's just make it safer. Thank you.